We're going to learn more about lung cancer and an update on when you should get screened. Joining us today, Senior Development Manager with the American Cancer Society, Cheryl Eddy. And thanks for joining us, Cheryl.
Thanks for having me this morning.
Okay, so November, we talk about the Great American Smoke Out, and, lung cancer is one of the issues with smoking. First of all, we've got screenings, right? But what are the guidelines? Who should get screened?
Yeah, so they just recently updated the guidelines. So this is hot off the press. The old guidelines, they were recommending the ages between 55 to 74. And the new ones is actually 50 to 80. And then also, if a couple other changes, if you've smoked 20 packs per year, you qualify. And there is no longer an age requirement or requirement on when you have stopped smoking. In the past, it had been 15 years or longer, but now it's if you quit today and you meet any of the other guidelines, you can get a free screening.
Okay, so to get this screening, do you have to be having problems with breathing or whatever, or is this try to catch it early, kind of like a mammogram?
It's try to catch it early because they are estimating 238,000 new cases in 2023 coming up. And as we know, lung cancer is the second leading cause of cancer, but it is the first for death in men and women. So it's something that they're really trying to be proactive, get your preventative. So if you're eligible on any of the criteria, please talk to your healthcare provider and get a lung screening.
Okay, so we did talk about smoking. Are there other conditions? I mean, do you have to be a smoker maybe to get lung cancer?
Nope, absolutely not. And that is one of the scary parts. Most people think you do have to be a smoker, but if you live with someone that has smoked, if you're around secondhand smoke, maybe if you work in industry or you're around some different chemicals, it can also have lung cancer. And unfortunately, there is just the genetic makeup and genetic odds too. So it is definitely something, if you have lung cancer in your family, a history at all, be open to your healthcare provider so you can get the first step to being preventative.
Mm-hmm. Now, is the screening very hard? Or is it pretty simple?
It's pretty simple. They just take a little picture of your lungs and look into your lungs, and it'll be like a little CT.
Okay, all right. Now, as you mentioned, anyone can get it, and that makes it scary. But is it like many things, early detection, and it could get treated? I mean, is there pretty good treatments for lung cancer right now, or is that one of the things that we're working on?
We are still working on it, but just like any other type of cancers, any type of diseases, the earlier we catch it, the better treatment and the better outcome that the patient might have.
Right, yeah, exactly. All right, lung cancer, and I know November is also Caregiver Month, and when you're caring for someone, a loved one, a friend that has cancer, that can be stressful. Do you have any tips for caregivers, or can you go to some place from the American Cancer Society to get some help?
Yeah, absolutely. So being a caregiver is definitely probably one of the most hardest, but yet most rewarding tasks that you can be, I guess, assigned to, that you can take on with a loved one. We just recently updated our website with different videos, care techniques, and they also have physical care training. So if you're helping a loved one and you can help manage side effects, check for signs of infection, drainage care, lifting care, it's all stuff right there accessible, that information that you might need. And you can visit it by going to cancer.org/caregiver videos. And that'll be your resource guide, videos if you need to vent, and if you really need to connect and relate to other caregivers throughout the country, because it is tough and it is hard.
Yeah, exactly. And sometimes it's hard to admit that you're having a hard time taking care of someone,
It is, because you want to be the rock for your person, but yet you need to make sure you're taking care of yourself too, and making sure your self-care does not get behind.
Right, yeah, exactly. All right, some great stuff to talk about today to raise awareness. Thank you, Cheryl, for coming.
Thank you.
All right, don't go away. Noon Edition continues in a moment.